Good morning, everyone. This is our regularly scheduled Public Safety and Emergency Management Committee. Today is Wednesday, March 18th, 2020. And even though we are not a quorum of the committee just yet, we are going to begin the presentation on the city's emergency management plans in response to the COVID-19 pandemic. So I'll just review the agenda really quick, and we'll note that this morning we are joined by Councilmembers Linnea Palmisano, Councilmember Steve Fletcher. Councilmember Lisa Goodman is here participating in our committee this morning as a guest, and my name is Alondra Cano, and I'm the chair of the committee. So we have 3 items on our agenda today. Item number 1 is receive and file of public comment. Item number 2 is a passage of a resolution accepting a gift from the East Isles Residents Association for fixed cameras on Hennepin Avenue. And item number 3 is our discussion, which is the COVID-19 preparedness and response presentation by our city staff. Any questions on the agenda today? Looks like we're good. So since we can't take any formal actions to receive and file or approve, good morning. We are joined by Councilmember Jeremy Schrader as well. We will just go ahead and dive right into the discussion item number 3 and begin the presentation. So we welcome our city leaders who are here today to help us kick this off. And originally when we had discussed this, we had asked the health department to set the stage briefly for about 3 to 5 minutes and then hand it over to our emergency management staff, leadership, and Minneapolis Police Department, as well as our firefighter department team. So please go ahead, Noya, and welcome to the, not the dais, I'm sorry, the podium.
Thank you, Chairman Cano, Chairwoman Cano. I will take 1 or 2 minutes. Just to give you an update on the worldwide status of COVID, there are more than 201,000 cases worldwide and more than 8,000 deaths globally so far. There are 156 countries reporting cases of COVID. Most of those cases are now outside of China. And there are community spread cases of COVID in several countries. In the United States, there are more than 6,000 cases and 114 deaths. There are cases in all 50 states, the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. In Minnesota, there are approximately 2,336 patients that have been tested. 60 have resulted positive cases. 3 people have been hospitalized, 1 critical. In Hennepin County, there are 24 cases, and community transmission is identified in 3 counties in Minnesota, Dakota, Hennepin, and Ramsey. The state is not sharing information at a city level to protect confidentiality of those people getting COVID. And the Minnesota data is updated every day at 11, so this is current as of 11 o'clock yesterday. And that's all I have.
Thank you very much.
Yes.
All righty, I think we are ready.
Madam Chair, members of the committee, thank you for this presentation this morning. We appreciate the opportunity to address you and to give you a briefing on our preparation and response across the enterprise. The batting order today, Chair, with your consent, would be the police department, the fire department, public works, and then I will be the cleanup hitter, if you will, and we can get into some of the framework of all of this. But if that's acceptable to you, Madam Chair, we will proceed in that order.
Thank you, Director. Appreciate it.
Good morning, Madam Chair, committee members.
Good morning.
I want to take the opportunity to let you know that from the police department standpoint, COVID-19 has not significantly impacted our operations. So from the broader city perspective, we are still making sure that we are engaging with our community each and every day, keeping our both our residents, our business community, and certainly our visitors and workers safe. So while COVID-19 has not impacted our normal day-to-day operations from the Minneapolis Police Department, we have certainly tweaked some of those service deliveries that we are doing in light of the COVID-19 response. I will also say that as we are getting great guidance from our city's Commissioner of Health, Gretchen Musicant, we are using certainly her advice, her guidance from both MDH and CDC to help make sure that both from a workforce perspective that we're doing everything we can to make sure that both our sworn and civilian members are protected and minimize their risks of exposure, and also just as importantly making sure that our communities are also, when they come into contact with us and when we come into contact with them, that we minimize their risk of exposure. I will also just say, as I'm staying in touch and contact pretty much on a weekly basis with my counterparts from across the country, in terms of what other police agencies are doing in light of COVID-19. I will tell you that it's very different, very dynamic for each jurisdiction. More recently, talking with my counterpart in New Orleans, they are certainly doing things differently down there in light of this, as well as New York and certainly Seattle. I will also say that the mayor's recent emergency declaration, and I know that is such a weighty and enormous decision for our elected officials to do, I think in terms of doing our best to minimize the spread and large gatherings, I think that was certainly important for our first responders. So I do appreciate all of the decision-making that came into that. At this time, Madam Chair, council members, I'd like to have both Commanders Granger and Glampy come up here to talk about what we're doing in terms of the workforce specifically to that, as well as what that operationally looks like in our engagement with our communities. So if you don't mind, I'd like to have you proceed.
Good morning, Commander Granger, Minneapolis Police. Chair Connell, committee members. I'm going to talk a little bit about our workforce protection measures that we have in place. The MPD is taking steps to better assure our own sworn and civilian workforce is protected as much as possible when dealing with the public, including the issuance of PPE to 911 responders and frontline staff who may need to deal with those afflicted with the COVID-19 virus, including identifying specific protocols and procedures for interactions with persons who are confirmed to have COVID-19. We've already issued PPE, including N95 masks, gloves, and also eye protection to our 911 responders. And our intent is to broaden the issuance of that equipment as soon as more supply becomes available. We've had some challenges in obtaining some of those supplies. We have some things that are on order. We have some things that are delayed, and then some other things that are not available, but we're also researching alternative products wherever we can find that as well. Our protocols and PPE are consistent with CDC recommendations to include distancing at least 6 feet whenever possible, and to use PPE and if close contact is required with persons who have or are suspected to have COVID-19. We've identified a decontamination vendor that we can use for disinfecting our squads should that be needed. We've also encouraged our employees to sanitize the surfaces of their work areas and equipment before and after use. Our roll calls we've asked to be limited in time, and along with asking that social distancing, the 6 feet, be incorporated into that. Hennepin County Jail also has new booking protocols for those who may be infected, which we've shared with our personnel as well. Non-sworn employees who are able to work remotely are being asked to do so. We're looking to expand that to more employees. We're going to be acquiring a few more laptop computers today, so more people will be able to do that. We're reducing contact with groups in the general public and non-patrol settings as much as possible. And when that isn't possible, employing the 6-foot distances in those meetings, and also encouraging people to, whenever you can do an online meeting or a conference call, that we do that. Let's see. Almost all of our training has been postponed, and any employee who may be sick is asked to stay home. Our goal is to provide the best support and wellness measures for our dedicated sworn and civilian team members.
Good morning, Madam Chair, council members, Commander Scott Gerlicher. I just wanted to go over some of our staffing contingencies. Obviously, a big priority to make sure that we continue to offer the same professional service, and especially that 911 response to all areas of the city. We're confident that we have now and will continue to have that ability to provide that service. So there's various ways. As the chief pointed out, we don't have any current increased absenteeism as a result of this or anything else. However, thinking forward, that certainly could change in the coming days or weeks as we move along with this. And so we're able to do some things internally and then, think long-term about stuff. So, for example, even today, we're able to very easily move officers from precinct to precinct to help out on individual calls, or potentially if one precinct has a number of officers that are sick, we're able to very quickly and easily move those officers around from precinct to precinct to help out with 911 response. The next step of that would be to move to some of our support units, such as our community response teams, some of the other teams. We have community engagement officers, other officers out there that could be pulled from their assignment to help out either on a given day or for a longer period of time. And then as we would potentially move forward, if there were increased absenteeism, we're able to go a little bit deeper and temporarily transfer individuals from investigations, other areas where we can still continue to support those investigative functions, but really similar to how we do on a special event, use those resources to our first line, our front line 911 response. And then if we were to go even farther down the line, we have a contingency in place where we could utilize police officers to do things like take phone call reports over the phone from our special operations center, should that become necessary, to reduce the calls for service in the field. And then moving in deeper, you may be aware, but the chiefs had some conversations, and we have existing mutual aid agreements in place with all agencies in the metro area and Hennepin County agencies. And those discussions have been taking place so that we're able to either help out another agency who may have increased absenteeism or receive some of those resources. So we're confident, I think, as a department and as a metro agency, having worked together many times before, that we're able to maintain those critical services and 911 response in the field at all of our precincts. Thank you.
Yes, we are allowed to ask questions as the conversations are happening. Would you like to? Okay, so Councilmember Goodman is in queue.
Thank you, Madam Chair. First of all, I want to just thank you for holding this committee meeting today, Madam Chair, as well as the Chief of Police and Fire and Barrett Lane for being here, and all of your staff. I'm interested, Chief, in what you're seeing in terms of crime trends around the city based on the fact that people have been essentially voluntarily sheltering in place. In my ward, I've seen we had an armed robbery with a gun and 2 guns stolen. Kind of unheard of in the Kenwood area, right? And then another person chased down the Cedar Lake bike trail on their bike with a car and held up at gunpoint. Those are unusual for the ward that I represent. I'm wondering what you're seeing in terms of overall trends, and if you can just share a little bit about, it might be just from one kind of crime to another, or maybe crime is down all over, or unfortunately out of desperation it could be higher too. So I'm hoping that the chair, even going forward, would maybe think through, could we have a briefing in writing or in committee about where crime trends are going as we move through this pandemic. Thank you.
Madam Chair, Councilmember Goodman, thank you for your question. So we, unfortunately, were dealing with some increases in our Part 1 crimes last year that is still carrying over to this year. And so our Part 1 crimes, obviously the robberies, as you mentioned, certainly assaults and what have you, and burglaries. I'm going to be really leaning in towards more from now until the next couple of weeks. We certainly, with the governor's declaration of the school closing, so that will be a different dynamic for us to watch to see what the amount of youth that are now out of school, how that plays out throughout our city. but also with the certainly the mayor's emergency declaration with businesses, nightclubs, restaurants, and those closings. I have had conversations with our precinct inspectors to watch to see if we should happen to see a trend in burglaries, quite frankly, if folks are knowing that many of these businesses are closed. So so I don't really have much data right now since these two major events with the school closings and certainly the business being closed, but I'm making sure that through our Deputy Chief of Patrol, DC Waite, as well as our inspectors, to start monitoring to see about the impacts of COVID-19, particularly with our businesses and our residents across the city, to see if we're seeing any sorts of spikes that are just kind of anomalies, as you just mentioned. So as of right now today, I don't have anything specific in terms of trends with COVID-19, but I think moving forward, we are definitely staying on top of that.
I did just want to acknowledge that Councilmember, my goodness, I was always going to call your dad's name, Jeremiah Ellison. Every time I look at you, I'm like, Keith Ellison. Apologies. So Councilmember Jeremiah Ellison is here, and if anyone has any further questions, we can also just keep asking questions throughout. And Councilmember Andrea Jenkins has also joined us for the committee meeting. Councilmember Fletcher.
Thank you, Chair Cano. I'm not going to put you on the spot and ask a lot of questions right now because we are all sort of inventing our response to this as we go, and I just want to express my gratitude to everybody who is doing frontline work. I know that it is critical to our city, that everybody who has to show up in person and sort of responsibly manage a global pandemic that is visiting our city are doing that work. So I want to just really express gratitude for the work that you're doing, and then encourage you. I think as we settle in, we know that all of our protocols are going to be stress tested by this, and we're going to need to make adjustments, and we're going to see things change, some that we can kind of predict and that I hope we're thinking ahead to, and some that are going to be challenging to predict. So I just want to encourage you to keep in touch with us. Obviously, we're setting up mechanisms to do that and empower the mayor's office to be very responsive as we need to make those adjustments. But really want to thank you for this presentation. It is comforting to hear everything that you already have in place, and to hear that continuity is being maintained. Please keep up the good work and keep us posted about what you need from us.
Madam Chair, if I could just comment to Councilmember Fletcher's. I will also say that from certainly the public safety standpoint, I think we in a city are better prepared just because of the leadership in this city, the enterprise communication that we're all talking. Many of you probably know every day. We're all talking and making sure that we're doing our best to really make sure that we uplift our city, make sure that our community members are safe, and certainly keeping them healthy, as well as our workers, our employees here of the city. So I think we're, in light of COVID-19, I think that we're in a better position than probably other cities around the country.
Thank you for that. I just want to say, Councilmember Schrader, if you do have questions, just wave to me because I can't see the red tag. And we have Councilmember Palmisano with a question.
Thank you, Madam Chair. Chief, perhaps in terms of service delivery and keeping your existing force healthy is what's important at this point in time. I heard commanders say, for those who might be infected, how we address those who might be infected. And given what we know about this virus, it seems that people could be infected and contagious long before they even have obvious symptoms. So I'm just curious about how we're identifying that. I know that, for example, in a neighboring suburb, police have been instructed to no longer respond to a service call of someone in respiratory distress, so that it's handled completely by EMS. And that is just their way to try and keep their first responder police force as safe and free from contagion as possible. So I'm just curious if we are treating everybody as though they might be contagious at this point. And I heard that personal protective equipment is harder and harder to procure right now, but I guess I'm just curious how do we know who might be infected, or how are you instructing your staff to approach people who might be infected, because we don't know?
Madam Chair, Councilmember Palmisano, that's a very good question. So I think we are really trying to approach this in two ways. So The first way that we're really trying to do is making sure that we, once again, through MDH and CDC guidelines, making sure that our sworn in civilians who are going to be more likely to have some of the increased exposure risk, making sure they have the protective equipment that they need, N95 masks, doing everything from even changing some of our procedures with some of our public-facing lobby areas, more conferencing calls, those types of things. We are also, particularly for our frontline first responders, we're working very closely, and I know that Director Hughes will probably be talking here in a minute, but they're doing 911 triage even before our first responders arrive, asking such questions to those callers. Has anyone in the household recently traveled? Have they experienced a flu or fever? We're making sure that if we do not have to respond, if it's not particularly a 911 police response, that we're leaving that up to the medics, and usually, whether it's fire or our Hennepin EMS. So we're doing some of those things. There's also the wellness of our employees, and I was on a recent call with Council Vice President Jenkins, who mentioned this. What are we doing to also make sure, as we're going through this, that our employees' wellness, because they're being impacted, their children, their loved ones at home may be impacted by this, and so we're making sure that we're reaching out with our wellness teams. Matter of fact, at some point in time over the next 24 hours, we'll be working to put out a video that our employees can have over their phone that will equip them with resources and our Optum 1-800 numbers and just different resources to make sure that they're supported in that regard. Again, this is evolving each and every day, so we're learning what are some of those best practices. But again, through our city staff, through our public health, our OEM, fire, we're all working to try to make sure that we're doing the best we can for our employees on those two fronts.
And Madam Chair and Chief, if I can interrupt, I think the Deputy Commissioner wanted to just weigh in on this.
Yes, thank you, Chair, woman and council members. Just wanted to respond to a couple things in your question. One, the virus is not truly contagious until you are having symptoms. So you could be carrying it, but you're not contagious until you are exhibiting symptoms. So there is not as much need to be concerned about that kind of dormancy period of 14 days that everyone is talking about. Secondly, we are operating off of CDC advice ultimately, and that right now is that first responders, particularly EMS, are fine with the masks, just a regular mask that any of us could go get at a store. But that EMS is also priority in terms of having access to the number of those masks that they need. There may be some change in advice coming from CDC. I think, like you're all aware, there's changes in this every day, and we're keeping track of that. And as soon as we hear that change coming down, then we share that information out with our partners here in the city. Thank you.
Thank you, Madam Chair, and thank you to the people responding. That's an important clarification. And I really appreciate your 911 partners' flexibility in being able to change how we're asking questions. Thanks.
Councilmember Jenkins.
Thank you, Madam Chair, and thank you to all of our frontline staff who are, responding to this crisis. And I know you mentioned that things aren't necessarily changing at the moment, but they certainly will. I'm curious. Deputy Chief Gerlicher talked about arrest protocols and Hennepin County Jail, and I'm wondering if you could expound on that. What might be some of their changes, and what are some of the changes that we are doing around arrests and that kind of thing?
Madam Chair, Council Vice President Jenkins, so one of the things in reference to Hennepin County Jail, Sheriff Hutchinson has recently made some changes specific to COVID-19 and their intake procedures. So they are doing screenings at the jail. Obviously, they want to make sure that they minimize the risk and exposure to folks over there. They are asking now, and this was just recently changed, I think, within the last 24 hours, they're asking now that any transports of people who have to be booked into the Hennepin County Jail, if they're exhibiting those signs, they want the individuals to stay with the police officers in their vehicle. They will then radio in or communicate to have one of their jail intake persons come out. They'll make an assessment there, and of course they have medical staff there on the jail to make that assessment if that's something that they will continue to process them into the jail, or if it is a need for that person to seek medical attention at one of our local hospitals. So that is one of the things that they are doing there. In the event that Hennepin County Jail should become to the point where they can no longer take any more because they're experiencing a contamination or the virus has hit their jail, then they've got an alternative with the workhouse in Plymouth, Minnesota that would be an alternative for us to take those folks that need to still be processed and held under the remand of Hennepin County Jail. So we're constantly talking. Sheriff Hutchinson is convening with all the local chiefs on teleconference calls in terms of any updates that impact their work over at Hennepin County Jail.
Madam Chair, may I? So I understand that the jails are the jail is currently overcrowded right now. There seems to have been a significant spike in arrests, particularly of low-level crimes, people sleeping on trains, who are clearly homeless. And other low-level crimes. Are we thinking about how we are going to be addressing these kinds of concerns and alternatives to arrest and or jail?
Madam Chair, Council Vice President Jenkins, that's a very good question. And so we certainly the last couple of years have really looked at, we do not want to first of all, focus on sending people with low-level types of crimes to Hennepin County Jail. We are still focusing on those who have committed some of the more egregious felony-type crimes to be booked in and processed at Hennepin County Jail. We're certainly aware of the jail's population. We've got some good ordinances and policies in place right now that whether it's payable fines, those types of things that are really limiting the number of people who are committing the most serious crimes, making sure that those are the ones that if they have to be booked into Hennepin County Jail, that's what they're doing. In light of COVID-19, we want to continue to make sure that is our practices and protocols moving forward as well. We are seeing that also being echoed around the country now, of course, in light of COVID-19 as well. So we'll continue to monitor that. I think I could certainly speak for Sheriff Hutchinson by saying the same thing with the matters that his jail is dealing with, and certainly in light of everything that's going on, they want to make sure that the jurisdictions around Hennepin County are making sure that those folks who have to be processed over there are, committing the most serious types of crimes in the city or in the county.
Yeah, thank you. I mean, it goes without stating, this is a highly vulnerable population as well as, quote, a captive audience. I mean, they are in close proximity to each other without any opportunities for social distancing or self-isolation and these kinds of things. And so the more we can keep people out of those situations, I think is going to serve our broader community very well.
Madam Chair, Council Vice President Jenkins, absolutely. And so our homeless and vulnerable populations liaison teams, Lieutenant Snyder, Sergeant O'Connor, they're also working, you had mentioned Metro Transit with the light rails, they're also working with their homeless teams as well to make sure that we are not criminalizing folks who are experiencing homelessness in our communities, and working with our other city and county folks in terms of some of the other placement and sheltering while this is occurring. So.
Chief, I do have one quick question. Under the council is scheduled to vote on the mayor's declaration of emergency tomorrow, Thursday. If the votes, if the council members approve that, does that change any powers within your department? Like, are you able to enforce things differently, faster, bigger, better kind of a thing, or does everything kind of stay the same in terms of the enforcement authority that the police department would have under a declaration of emergency?
Madam Chair, committee members, for right now, and I'm going to have to lean over to my good friend Mr. Bert Osborne from the City Attorney's Office, but right now I think that we would still operate under our same normal policies, protocols, and practices. Some things that I've seen from around the country where mayors have made similar declarations, they have tweaked certain things in terms of public gatherings and being able to enforce certain types of large public gatherings. I'm thinking more recently in New Orleans and some other places. But in terms of the law and how we normally typically operate, that we would still do that. I think that unless the mayor, through some guidance and direction from our attorneys, were to change certain things or need to put in temporary sort of different restrictions, then we would obviously operate and make sure that we're in compliance with legally with what we can do.
Madam Chair, members of the committee, I don't think the mayoral declaration changes anything about the police department's current enforcement authority. If the mayor were to do something further with a regulation of some kind, if the need presented itself, that might change that, but right now I don't think it does.
Thank you. Looks like we don't have any more questions for you. Thank you so much for your leadership. Appreciate you being here. Who's next? Our fire chief. Welcome.
Madam Chair, committee members, thank you for the opportunity for us to come and present to you this morning. With me, I have my Deputy Chief of EMS and my Assistant Chief of Operations in case after our presentation there are any questions. We're also here to answer those questions. Much like Chief Arredondo, we are operating, at least to this point, pretty much in a normal operating mode. We have obviously changed some protocols that we in terms of personal protective gear for our fire crews, but we haven't seen a big spike in number of runs as of yet. It's been pretty normal. Do we expect an increase? Yes, we probably would expect maybe a dramatic increase as we move forward. But with that being said, I'd like to open by saying that our number one priority is the safety and protection of our firefighters, to make sure that they are safe, they are well protected, and they can still continue to provide the quality service that's going to be required. We are also continuing to work with our partners that are all sitting behind us, whether it be local, state, and federal public health officials, law enforcement, our dispatchers, and especially Hennepin County Medical Center. We are in almost daily conversations with Hennepin County Medical Center because we do provide first-in EMS support for them. So we have a lot of patient contact within the community. So I think it's very important that we stay engaged with them in terms of guidance, and we are following the guidance of our medical director, Dr. Jeff Ho, and also in coordination with Dr. John Hick from Hennepin County Medical Center. They are giving us guidance every day on best practices, both locally and from the national best practices in response that we may face in this scenario going forward. We have internally updated our pandemic plan. We've had a pandemic plan for probably 10 years in our department. That plan has been updated. We also have a infection control policy that our firefighters, for our firefighters and protection of our firefighters, that has been also updated and distributed. We are currently, yesterday we had our first video conference to all the stations. So we opened up all 19 stations, and myself and my deputy chief of EMS and the Mark Lakoski, Local 82 president, we all sat and were able to talk real time to all of the fire stations yesterday. And at the time they were able to text back in with questions they had to help quell some of the, we all know we're all getting inundated with all kinds of information, concerns from all directions. So it's a great way for us to disseminate the information that we need to disseminate to our firefighters. I'll be holding another one of those at 1300 today, and again repeating that tomorrow, and they'll be posted on a shared drive internally, so any firefighters who are off are going to be able to come in and click on that and review that and have the latest and greatest information that we have. In terms of cache of protection for our firefighters, the fire department has its own internal cache of, you've heard the term N95 masks. We have some internal cache of N95 masks. It is not an endless supply. We are certainly, when we talk about guidelines for our firefighters, we're talking about guidelines of how many times they can reuse an N95 mask if it has not been contaminated. In other words, if it hasn't gotten wet or has obvious signs of contamination, it potentially can be reused, put it back in a protective bag and then reuse it. So we're all those types of protocols, and we're taking that guidance from Hennepin County and best practices. Hennepin County paramedics are under the same types of guidelines where some of this can be very effectively reused. The term simple mask, what we're doing right now, every patient, every respond, especially on a respiratory type of run, the firefighters are putting on, and this is a simple mask that a lot of people are talking about. That simple mask goes on each of those patients. Now, if it's just a normal EMS run where there's no symptomatic issues with respiratory issues, they can put a simple mask on the patient. The firefighters can also use a simple mask on themselves and have plenty of protection for that type of run. Now, if it's respiratory scenario, then they can go to an N95, simple mask on patient, N95 on themselves. That's sort of a lot of the things that we've been working on. It changes daily depending on the information we get from our medical director. In terms of staffing, we have updated our staffing guide. We normally operate in an area of 102 to maybe 106 firefighters working a day. We have a staffing guide that has been completed that takes it down to a much lower number than that. So if it came to that, we start seeing some absenteeism due to isolation, where we might have in terms of our firefighters becoming ill, we can effectively move down. We'll just move some rigs around. We'll change some staffing, make sure we keep as many of the fire stations open as we can to continue to provide quality service. That is going to be certainly a key concern of ours, and so it's very, very important. That's why I opened up by saying my number one priority is the health and safety of my firefighters, because it's a limited supply. I can't go down the corner and grab a bunch of firefighters. I have to. They're all licensed, and so it's going to be a very important asset and resource that we have that I am charged to protect, and I'll continue to do that. Anything I missed, Deputy Chief? As Madam Chair, open up to questions. I kind of went fairly quickly through this.
Similarly to what I had asked our Chief of Police, does the role of the fire department change, expand under the declaration of emergency, where you might be responding to different things or be serving as backup for other city efforts?
Madam Chair, no, it has not. We're going to pretty much maintain an same normal operating mode. And again, I could ask Mr. Osborne to weigh in, but I believe that it's just be a normal operating mode we're still in. I will say, I will like to add that we are in very close contact with our mutual aid partners in and around the city, especially in and around the Beltway. When you look at some of the outlying communities, they only have maybe 6 firefighters working a day. So if they run into these types of issues that could potentially happen, they could be impacted. So it's very important for us to talk with our mutual aid partners. I have been in contact with Chief Inks and St. Paul Fire, that we have already agreed that we'll be more than willing to share resources if we need to, if it comes to that. So I feel very effective. I mean, I'm very, very confident in the plan that we have moving forward, and to continue to provide quality service to the city through these very trying times.
I just have a follow-up question on that. So myself and Director Musicant had exchanged a few emails on today's presentation. And so there's a note here about how the emergency medical responders within the fire department might be called upon to respond to the pandemic if it spreads within the community. Is there anything else you can share about that? How many emergency medical responders do you have within the fire department? Is it every single firefighter that is considered an emergency medical responder? And how might they be activated to respond if there is a broader spread within the community?
Madam Chair, right now we have 424 sworn firefighters. All of us are EMTs. We all could respond, every one of us, except for my civilian staff. So we would all be able to, and we all are going to. We're all in this together. We all part of this whole pandemic response, and we would all work through a plan and to provide the quality service that the city would require in this very, like I say, very trying times. Mm-hmm. It can get to be, and it will get very difficult for us. I know that. I know that it will. I just want to make sure that we maintain a nimble enough position that we can effectively maintain certainly fire protection. Will our EMS responses probably change in terms of our mission and protocols? Yes. Will we potentially become overwhelmed? Very possible. That includes even Hennepin County. At the present time, for example, I'll just give you an example of some of the changes that have already been made, and I know that Director Hughes will probably address some of those. We've asked dispatch in our senior like nursing home facilities, if a patient's ambulatory, to bring that patient to the front door to meet the responders, to minimize our exposure in that building, and them from us and us from them. So we don't come into that building and potentially expose it, to keep them as safe as we can. So a lot of those types of calls, if we can, we have people meet us at the front door. We can start engaging and making some patient assessments at that front door to maintain that barrier, and then we can make effective decisions from that. So those are the sort of extreme measures that we've taken that we haven't done before.
Alrighty, sounds good. Well, those were my questions, and it looks like we don't have any other questions in the queue, so thank you very much for your presentation. Appreciate it.
Good morning, Chair Cano and members of the committee. I'm here to present to you on Public Works status and activity related to COVID-19. I gave a similar update yesterday in Transportation and Public Works. I'm going to start today by assuring you that Public Works remains at full power, full staff at the present time, and that all of our services are continuing. That being said, I also want to reassure you today that we are in a state of readiness, that we have prepared our internal continuity of operation plan that considers multiple scenarios. And what that means for us is being sure that we will be able to continue to deliver essential services to the city. Those essential services include maintaining safe drinking water, continuing our garbage and organics pickup, continuing our traffic signal operation and other street operations necessary for safety, maintaining the city's fleet for fire, police, and our own public works functions, performing emergency repairs on city streets, which includes water, sewer, obstructions in the street, and other items, and also compliance with numerous statutory and regulatory requirements that we have today. I want to address more specifically the questions that have been surrounding drinking water. Of course, this is an essential service for the city, and it's understandable that our public will want to be reassured. And I'm going to provide clear reassurance today that there is no risk to the city's drinking water, that our current practices of filtration and disinfection provide an effective barrier against COVID-19, that this analysis prepared by our chief chemist, George Kranick, has been supported by research and guidance from the Environmental Protection Agency, the Center for Disease Control, and the World Health Organization, and that our city staff train always for environmental and biological challenges and employ multiple levels of redundancy in their everyday work to be prepared for a situation such as this. The public does not need to buy bottled water. Your drinking water is safe. I also want to assure you that if we experience a high level of absenteeism, that we will be able to continue to provide safe and clean drinking water to the city of Minneapolis and our wholesale customers, that our staff is cross-trained to be able to perform multiple functions, and that applies to really many of our functions as a city. I'll say this again, I said it yesterday during Transportation and Public Works. There was some groundbreaking work done by my predecessors, Steve Kotke and Heidi Hamilton, who created two service categories, Service Worker 1 and Service Worker 2, that allows us to cross-train from the beginning our staff. And for that reason, should we experience a high level of absenteeism, we will be able to focus on those essential services for the city. That is the extent of my presentation today, and I will stand for any questions that you may have about Public Works function.
Thank you, Director Hutchinson. We have Councilmember Lisa Goodman. Please go ahead.
Thank you, Madam Chair. Some of my colleagues, in particular, Councilmember Schrader and Fletcher, have put out really good communications to the media, to the constituents through their newsletters, and we are being asked to do the same. I'm wondering if your statement is in writing somewhere. We can send that out. I think it was a really good statement, especially the detail about cross-training as well as the CDC checking on the water. I was here when we built that ultrafiltration plant. It was a big drama, actually, about whether or not we should spend that kind of money, but we did. And I think it would be a really good thing for people to get out, because this run on bottled water thing is like nails on a chalkboard for me with all those bottles. I'm sure a lot of people see that, and so I think it's important to note I'm drinking the water right now, and everyone probably does up here. It would be good if we could have something in writing that we could get out today. Thank you.
Chair Cano, if I could address that. We provided some preliminary talking points that I believe were the basis of some of the communications on Friday. Those are expanded. Just yesterday, we put out frequently asked questions that is posted on our website, and I'm happy to provide to you my talking points from today that will help you put out additional messaging.
Thank you. Councilmember Fletcher.
Thank you, Chair Cano. Thanks for this presentation. First, I want to just give Public Works credit where it's due. We are all looking for ways to support small businesses while they're struggling, and you offered some temporary help in identifying pickup areas for restaurants that are staying open for takeout only. So if anybody is looking for that, please do contact our offices and we'll help you connect and get that request in. But I appreciate that added capacity. I know we're all improvising together, and I've already heard from a couple of businesses who are at least thinking about making that request, and appreciate the gesture. The other thing I wanted to ask about is just how are construction crews progressing? Are we going to lose time on these projects, or are we maybe even going to be able to opportunistically pick up time while everybody's sheltering at home and traffic is a lot lighter, and do some disruptive construction work that's coming? So if you can just give us a short update on what you know about that so far.
Chair Cano, Councilmember Fletcher, I'm going to start answering this question by saying that our employees' health and safety is our primary function and concern from the leadership team for our employees in Public Works. And to that end, we've changed already some of our field operations practices in order to provide them a higher level of security, including how we muster, whether that's outside, it is now, how many people are included in that, the social distancing, how to travel in the vehicles, how many people are required for safety, how can we get that number down, cleaning the vehicles at the end of every shift, keeping the vehicles free from personal items. We have a number of measures that are in place and rolling out now, to be honest, still rolling out through our fields right now. This is a big week for us. Because we're able to do that, we will continue to work. We are out performing street repairs today. We are installing signs. We are fixing signals. We continue to do the work of the city. With respect to construction projects, I just discussed this with City Engineer Brian Dodds this morning. It's very specific to the construction project. So I will state that our plans for resurfacing and street reconstruction for the 2020 season as of today remain unchanged. You will be made aware as if that changes. And with respect to ongoing construction projects, I'm just going to give you a couple of examples of how it varies from project to project. On Hennepin Avenue, our contractors want to speed up. They want to do some additional work right now while the volumes are low and people are not traveling. So Don Elwood is working with our contractors to make that happen. On 8th Street, we are scheduled to continue that project. It happens to be right in front of HCMC. We will hold on that construction project until we understand the needs of HCMC before we make any changes to that street. So we are working through our active projects to understand which ones may have opportunity, which ones may need to be modified, and that's an ongoing discussion in Public Works.
Councilmember Jenkins.
Thank you, Madam Chair and Director Hutchinson. I'm curious, do you know about some of our jurisdictional partners, construction projects, Hennepin County, MnDOT, and is there any updates you can provide in that regard?
Chair Cano and Councilmember Jenkins, I can update you that we have a coordination meeting this week to discuss that. I've not been made aware of any blanket provisional changes from either organization, but that's of today, Wednesday, and we'll be continuing to coordinate with our partners.
Right. Looks like we don't have any more questions. Thank you so much for
Thanks for the
your
opportunity.
clarity. Appreciate it. Director Lane.
Madam Chair, council members, I wanted to take a pause here and tip of the hat to the clerk and the attorney for letting me know this, but there was a 5.7 magnitude earthquake in Salt Lake City this morning. It just reminds you that all the world continues to go on, and this is where the resilience that we have built over all these years is really going to pay off. When I come and do my budget presentation, you've heard it probably too often, but I talk about a resilient Minneapolis organization serving a resilient Minneapolis community. See, these are the days where that resilience pays off, and what you've heard just now are examples of the variety of ways that we are organizationally resilient and we are adapting to the challenges that are in front of us. So I want to say before I begin that I really appreciate the work that has gone out across this organization and with the council and with the mayor to activate these resilient systems that's going to see us through this situation and whatever else gets thrown at us in the meantime, right? So I do want to say thank you to you and to all of my colleagues and everyone in the community that's cooperating and doing what we need to do to keep each other safe and keep this curve down. So I want to address 4 items today, and I'll do it briefly, and then we can have the question and answer session. I want to talk about the Emergency Operations Center and what we're doing in that space. We'll talk about continuity of operations, what a business calls business continuity, if you're more familiar with that term. We'll talk very briefly about continuity of government. How do we keep you folks in business? And then we'll talk about the executive authority questions that you had asked me to address. We'll touch on a quick briefing on that. So that's the agenda, and of course we'll take any other questions that you may have. So let me start, if I may, with emergency operations. So we started an active incident on this at level 4 in overall operations back in January 24. So we've been tracking this for a while, and obviously a lot of stuff had been happening before that. But we put a marker down on that day just to officially start the processes moving. And as you may recall, we basically just wrapped up the Drake fire response at that point in time. So we kind of rolled from one to the next. So what we basically do in that phase, so that's all about preparedness. We went back through our plans. We worked with our partners. We started moving the Emergency Operations Center up into a higher state of readiness. Now, we would have done that anyway because we're getting ready for storm season. And as we learned, and it's waiting for us, is storm season is coming anyway, and we're doing that regardless of what else we're doing right now. So on March 6th, we moved to our enhanced watch mode, which bumps us up a level as far as activation, and that was when the first case was identified in Minnesota. Since then, we've been preparing the EOC workforce. As you may recall, we draw support for the Emergency Operations Center from across the enterprise. We're trying to keep our footprint as low as possible, recognizing that folks are going to be stretched in that regard. The mission of the Emergency Operations Center is to provide that multi-agency coordination that you're seeing here today, that we all are working together and have a common approach to this. But we're also the conduit by which requests flow up to the state and to the federal government ultimately, and it all flows back down. And we've seen a lot of mechanisms being activated around that as well. So we've tested our systems, we've talked with our folks, we've got things lined up. We opened the EOC on Tuesday. It's a soft open, it's virtual. We've got the entire facility set up. Everybody is distanced. We've taken up as much room as we possibly can. We do not plan to actually put people in those seats right now. We're going to try to stay as virtual as possible and keep people as distant as possible. But in the event we needed it, we wanted to take the time now to get everything stood up so that we're not scrambling out, hooking up phones and digging around in closets and that kind of thing. The enterprise staff is on standby. We're not asking anyone to report to the EOC at this time. And as you can imagine, we're in constant communication with our partners in the state, at the city of St. Paul, with the counties of Ramsey and Hennepin, and indeed the entire region. So right now, the posture of the Emergency Operations Center is open. It is ready for business. We're already processing some few requests through that process, and we will staff that with EOC, our OEM staff, until such time as things get busy enough that we're going to have to start reaching out. So I know, Madam Chair, if it would be best to pause on each of these items, or if you want to kind of drive through the whole thing and then take questions. Your preference, ma'am.
Yeah, let's pause right now and see if we have any questions or comments from council members. I'm not seeing any right now. I did get the updated binder and the continuity of operations handout. So tomorrow we take our big vote on this, and from your perspective, what is going to be the most significant thing that you feel we as a body can do to support your operations and your work moving forward?
I think supporting the mayor's resolution here is going to be the key. So, I mean, that's the one thing that we would ask that you thoughtfully consider that and support it. Other than that, I think you have to do what you always do, and that's stay in touch with the community. Get a pulse for what's happening out there. Keep yourselves safe. That's really what's going to be important as we move forward in these next few days. So we can talk a little bit more about the specific authorities that generates. But I think as far as what the most important action right now is, I think we have to keep this machine moving forward as it's designed and as we plan to. And that's going to help activate. Let me back up. There's not a whole lot of stuff that's behind the emergency declaration firewall. There's some very important things behind the emergency declaration firewall. And one of the most important things is what you're going to consider at that council meeting. So a lot of the stuff that we do in emergency, we can do day to day, and we do. So we walk through many of the things that we've done since you all have been in this term without activating an emergency declaration, because we have sufficient authority to get this work done. But when we do have to move quickly as an enterprise, that's when this really does kick in.
We have two folks in queue. We have Councilmember Jenkins and followed by Councilmember Goodman.
Thank you, Madam Chair. And Director Lane, I had an opportunity to just go through the emergency operations plan, and it is very thorough and very thoughtful. It really considers a lot of different scenarios and a plan of action, yet flexible enough to be able to respond to issues that we may not have thought through or just not been able to know that are going to happen. And so I deeply appreciate that. I do want to just note that, you know, some of the names and numbers, I think, need to really be updated so that we are able to really connect with the right people in a very timely manner. And I also was just a little, I know this plan was developed in 2016, I believe. You know, we as a city, as a council have evolved a lot, but there is no mention, consideration for equity in the plan. And, you know, I certainly don't think we want to go back and redo the plan at this particular time. However, moving forward in the future, I do think that we need to really try to consider how do we address equity in our emergency operations. You know, I've been toying with this statement that when America catches the coronavirus, Black America catches pancreatic cancer, maybe. And so, you know, these our emergency operations planning very well will exacerbate the inequities that we already have in our society. And so all that we can do to really be, I think, considerate of that, to understand how these things play out, and to really be intentional in our planning process to be able to address those things. So I just wanted to make that statement, Madam Chair. Thank you very much.
Madam Chair, Council Vice President, I think that's excellent feedback. We actually have a standalone equity plan within the office that Lori Burns has been working on. It's just not in the EOP. This is on a 4-year review cycle, and we'll be coming back to you very soon. So I think that's an excellent addition. The one thing I would say, and I think I can speak on, if I dare, on behalf of the entire staff, is to assure all of you and all the community that we won't forget. Okay, we won't forget the people who don't get a fair shake every day. We won't forget the people who don't speak the language that we speak fluently. And we will not forget the people we moved out of that homeless encampment. And talk about resilient folks. There's some lessons to be learned from those people. So honestly, I think you're really, really right on to remind us of this. But I think the thing that this council has done is really hold up those things so that they have really become, in the 20 years I've been here, much more part of the culture and the background thinking of how we do business here. And, my hat's off to you all for bringing that forward, and folks like, in the staff that are driving that forward. So you have my personal commitment that I won't forget. And if I appear to be, feel free to remind me.
Councilmember Goodman.
Thank you, Madam Chair. That was a good question, Councilmember Jenkins. Mr. Lane, you were here during 9/11 with me, and you've been here through a bridge collapse. So you have a really good kind of basis to maybe answer this question, even though I know you're not going to want to. Can you, as the Director of Emergency Response, give us a sense of where we're at as a community in the curve? Are we just at the beginning of things and we're looking at like 8, 10, 20 weeks of getting worse? Are we at the worst we've seen and we're heading towards getting better? I know you can't predict the future, and I understand that. And I understand that this emergency is different than others that you have seen. But I can't, if you cut out like the right-wing and left-wing media, and people are watching TV at home and they're freaking out about what's happening because the media is like all virus all the time, and then people are stuck at home, and watching TV is one of the things they can do. I don't have a good sense of where we're at. Are you planning for something that's going to last through the summer? Are you thinking that this is something that could be 8 weeks? Can you give us a sense of what, from your 20 some odd years of experience in this area, where are we at now, and what should we expect at a minimum?
Madam Chair, Councilmember Goodman, let me answer this in 2 parts. First of all, I'd like to, just on the science of this, I would like to turn to our health staff if you would like to address sort of the duration, and then I'll talk about my perspective in that context.
Of course, I don't want to make any predictions, so we're conferring if they should even say anything.
Chairwoman Connell, council members, yes, I just needed to make sure I would give you the right answer. So we expect that COVID will follow the typical cycle of flu. We will see an increase yet from where we are at, but during the summer months, we'll see a slowing down of new diagnoses, and then we anticipate it will pick up in the fall again. Our hope, like everyone else, is that by fall we'll have some sort of vaccine or medication to treat this in place. But we do anticipate that there will continue to be an increase for the next couple of months. Yes.
I just jump in really quick, just one for the health department. I mean, I've been reading a couple of things online about how there's like a 5-week period there. Could you explain that a little bit? I don't want to misspeak on that.
Yes. Madam Chair. 5-week period.
Well, I mean, the articles I've been reading say that, from the time that you are either expressing the symptoms or have the positive virus within your system, that there's sort of like a 5-week period for you to lay low, because that's also the time that you could continue to share it with other folks, because that's kind of like the lifeline of the virus within your system.
Yeah, so what we are hearing is that the worst of the sickness is anywhere from 10 to 14 days. But in order for someone to return to work, they need to they need to get 2 negative tests 24 hours apart from each other. So for example, if I were to get it and at the end of 14 days I'm feeling better, I would need to go in and get tested. If that comes back negative, I go 24 hours later, get another test. If that's negative, then I can return to work and unquarantine myself.
Fletcher.
Thank you. That raises questions about our testing capacity. If we're requiring tests in order to return to work, what is our ability to actually get people tested if we know that they have the virus and then we're asking them to test before returning? Is it even possible right now? I've not been hearing signs that it is.
One moment. I'm just going to call Catherine up here. She is part of our emergency preparedness team and is a member of our incident command structure.
Hi, Chair Cano, council members. Yes, so right now, yes, testing is limited globally, and I'm going to, for the sake of sharing consistent information, share what was mentioned at the peace presentation on this topic. So, and we have actually been in contact with the U.S. Senator Smith's office on this very issue because it's a priority nationally and globally. There's a shortage of the reagent needed to perform these tests. The United States experienced initial delays because the CDC tests that were put out were flawed, and many states that received them then were delayed in being able to use those tests. There was different tests put out by the World Health Organization that the U.S. chose not to use. So the ones that the CDC developed were rolled out. Those were faulty. They were called back in, and states began trying to develop their own tests to fill that gap. At the same time, then the run-on test has created this global shortage of the reagent needed. So right now there is no local capacity for testing. Tests are, when you hear tests, if you're given a test, you are just swabbed at your health center, and that is sent into the state for testing. The lab is running as many as they can. I just looked at the numbers. We're not over 3,000 yet, but of the cases that were tested yesterday, now as of 10 minutes ago, Minnesota's case count is at 77. We should anticipate that there is underreporting and that number is falsely low.
Councilmember Ellison.
Thank you. That is incredibly helpful. Not comforting, but helpful. This might be hyper local, but I know I've had a few constituents reach out who have spent time at the Hennepin Healthcare in the last couple of weeks and are, of course, I think I was reading this morning that someone at Hennepin Healthcare had tested positive. And so what, do we know how institutions are letting folks know if they potentially have been exposed by another patient or a nurse or anything like that, if that outreach is happening?
While, Madam Chair, Councilmember, while, Catherine, do you want to field that one? Sure. While Catherine's coming up, I just want to close the loop with Councilmember Goodman. And that is, I'm planning on a several-month scale here. I don't know that we're necessarily to see these measures for several months, but certainly this situation is not going to go away for several months.
Madam Chair, may I follow up?
Yes.
So is it your anticipation that when you think about it in a several-month point of view, that we're not going to be encouraging people to be gathering in groups, meetings, events, etc.? We might not have the state or the city might not mandate closures of things for that long, but community spread's happening already. So most people know now if you're in a place where there's a public place, you have a chance of catching it too. So I'm just kind of wondering about the guidance from our team on our neighborhoods who are canceling their annual meetings for like 2 weeks from now are already rescheduling them for the beginning of May. Maybe that doesn't make sense to be rescheduling them for the beginning of May. It's okay if we don't have to handle every little thing in the next 3 months. We could just focus on the basics for 3 months too and not have all of the boards and commissions, as an example, meeting. So I'm just wondering, a couple months, if we could give guidance on, please don't schedule your community annual meeting for May 5th, because we know that's within the several months. They might then hopefully push it out till September or something like that. What is your thinking on that?
So I think, Councilmember Goodman, through the chair, the best answer I can give you is I don't really know an answer to that. I think what we're going to have to do is stay flexible. I think the beginning of May, those type of calls are relatively easy to make. End of May, beginning of June. I just don't think we know enough about what this is going to do to start planning that far ahead. So part of our resilience is flexibility and our ability to adapt on the fly. So I think I would ask people to there's a book that talks about living with one foot raised to be able to shift to meet a challenge, and I would ask people to live with 1 foot raised with us here for a while until we have a better handle on that. And I think part of what the city's commitment is to get guidance on this is we do have something reasonable to know, but I think people are just going to have to, the closer you are to the May 1, I think the more likely you are to want to consider doing that. But the other part of that is I would suggest that, if you can, that businesses or even our office sort of lighten their load so that they can focus on the basics. That's really the core of business continuity. We'll talk about that in a minute. I was grateful that Councilmember Panasama canceled the results meeting because I was going to have to report to her that we threw our entire 2020 work plan out the window. And we'll have to rebuild that at some point here because right now this is it. This and getting ready for storm season. So that's the best answer I can give you, Councilmember Goodman.
Madam Chair.
And I think there was a subsidiary question there.
We have one question or a comment from the clerk.
I was just going to offer to follow up on a comment that Councilmember Goodman just made, specifically because you called to attention boards and commissions, and you may have seen the email that we put out yesterday from my office canceling the public meetings of our city's appointed boards and commissions, specifically for the purpose that until we have suitable arrangements in place that could support alternative meeting formats, there's no need for those members of the public who are volunteering their time for city business to gather in public places, nor is there a need for the staff who support them to expose themselves in that way. And so while we have suspended them through April 17th, we plan on using this time between now and April 17th to make the decision. Are we ready to launch alternative formats? If so, when and how? If not, continue to postpone until a date certain. So working with the city coordinator and city attorneys, we've made the decision to cancel the city's appointed boards and commissions regular meetings now through April 17th, where they are not required by statute or city charter. So we really are, as Mr. Lane indicated, really focusing on those core functions that have to continue during this time until such time as we can make an informed decision about how we can support those functions.
Thank you. All right.
Chair Cano, Councilmember Cunningham, and the council, to address the question about testing and exposure, all of the follow-up investigation on cases is being held at the state level. The Minnesota Department of Health is the lead on all of that. We are watching and in constant contact with them, monitoring to see if and when their capacity becomes overwhelmed. And then she stepped out, but Louisa, our she is much more qualified to answer all of these questions, so I'm going to cede the microphone to her.
Okay. Good morning. Sorry that I had to step out to answer a call. So I'm not sure what the question was in terms of testing, but I will just give you the...
I was just, I had asked constituents who are, maybe overly concerned, but concerned because they've been at places like Hennepin Healthcare in the last couple of days. They've read that, that someone there has tested positive. So they're sort of wondering, what's the follow-up? If I've been exposed by a patient or a healthcare provider, is someone going to call me and let me know?
Okay, so the way the process works from the state health department in terms of someone that is a confirmed case, there will be a case investigation. That person will be called, and the state health department will determine where they've been and who is, what contacts they've had that are high risk. Those high and medium risk, those folks will be immediately contacted and be told to isolate and to monitor their symptoms for 14 days. So anyone that has been exposed will be contacted by the state health department and asked to isolate and maintain for 14 days, monitor symptoms, meaning, take your temperature every day, and if you develop fever, cough, then call your healthcare provider if you're feeling really sick. If not, then just stay home for at least 7 days, 3 of which have to be without a fever, without the aid of any fever-reducing medication, so acetaminophen or aspirin. Ibuprofen, there's some debate about whether that actually can cause some additional distress, so there's not quite a recommendation yet. Or until your symptoms are better, whichever's longer. So if you have, fever and cough for 4 days, you then have to have no symptoms for 3 days and not take any medication before you can go out. If it's 5 days, then you have to be home for 8 days. So that is the new recommendation. And part of that is because if you are not in terrible distress, if you are not there's not enough testing material for everybody that wants to get tested to be tested. And so the priority is going to be for those folks that are hospitalized, because we need to know if they are positive because of the types of measures that need to be taken in the healthcare facility to avoid transmission. Possibly exposed healthcare workers, because we want to make sure that our healthcare workforce is healthy and available to be at work, especially if we get a surge of patients. And then patients that are from congregate living situations, including homeless shelters and jails, because those types of places have vulnerable populations and we could see quicker spread. So that is sort of the priority for testing that's done through MDH. Providers can access testing through private labs, but again, there is a shortage of raw materials for the reagents for the testing, and so there's going to be some prioritization of who gets tested and who just is asked to, if you're sick, stay home, monitor your symptoms, and make sure that you don't have a fever and you can get out after that.
Thank you.
All right, I'm going to see if there's any more questions or comments. None so far.
Okay. Thank you, Madam Chair. Let's move on then to, let me just make one more comment, then I'll move on to continuity of operations. Now that the EOC is running, we plan to do a weekly situation report. I know a lot of you are just want to be on top of what's going on, so we will be doing a situation report on a weekly basis, so just be anticipating that as well. Let's talk a little bit about continuity of operations. We've heard a lot about that, and Madam Chair, Councilmember Goodman's suggestion really kind of raises some of these issues. So what is continuity of operations at its ground? What we're doing is we're prioritizing functions within departments, and we're going to reallocate resources from lower priorities to higher priorities to keep those higher priority functions going. And this is exactly what the clerk is talking about. That's not to say that any of the lower priority functions are not important, right? But they have to be ranked, because now we're taking scarce resources and we're allocating them within the departments. So you've heard a lot of the different strategies that people are to do this. So one way of dealing with cancellation of meetings is to find a different way of meeting that doesn't solve the problem or doesn't create a problem, right? So there are different strategies that approach this. And there are really as many strategies as there are departments and subdepartments within the city. So I can tell you that every department has a continuity plan. We've freshly updated it. Every department has a pandemic plan. They're freshly updated. So all of that work has been done. at the department level. The enterprise has the capability then to rank things across the enterprise and then move resources from department to department if it gets to that point. So that we have a mechanism in place through HR to do that as well. So we've updated our what we call our concept of operations document, which ties all of these things together and links it with the capabilities of the Emergency Operations Center. There's a continuity lead in each of the city departments that is linked to my office. That's our primary connection for continuity to each department. And what we'll be doing we're started it tomorrow, sort of a beta test at this point. One of the activities that the EOC will be doing through the continuity leads will be tracking overall absenteeism trends and work at home trends so that we can get some data on what the enterprise looks like around some of these axes. So that's a work in progress, but it's going to launch. It has launched already, so that work is in process. OEM's continuity of operations plan, we are laptop capable, and we are all socially distanced right now. We can all work at home, so we have activated our own coup plan as well. The one thing I would like to do on continuity of operations is really thank the work of the city attorney's office, the IT department particularly. Patience Ferguson and her team have been outstanding throughout this. This is a workforce issue primarily. Thank you for their support. Property services, as far as backup facilities, communications. The COOP team here, that's our core service provider team, has been outstanding, and these folks have pulled several rabbits out of several hats over the last few weeks, and I just want to say thank you for them for doing that. Not that I wanted a rabbit, but that's what I got. So that is where we're at with continuity of operations. So again, we're at this point in time, we are looking at prioritizing services, and you've heard from some of the departments about where they stand with that. You can see that the strategies are customized to what they do.
I do have a question that's not specifically related to that, but the declaration of emergency and activation of your plan and other city preparations for a more nimble response to the quickly changing circumstances here is that we can then get federal aid or other forms of aid that might become available. I'm curious if you can give us any insights as to any projected timeframes or timelines as to when the city of Minneapolis might be eligible for that type of support and what that support might look like.
Madam Chair, at this point, I have no ETA on that. What we've done is take the steps necessary to open the mailbox, if you will. We check every day, but there's nothing. We don't have anything yet. We anticipate, and given the scale of this is literally unprecedented. Well, I mean not. Let's just say it's unprecedented. We don't want to dig up precedents that are worse, of course. But the emergency declaration that the president issued activates a number of federal programs, and at this point in time, I think I would, rather than just riff on that, I think I'd rather get you the real information on that. We have done what we need to turn it on, and we're taking the next steps. In fact, my staff is meeting with finance to ask exactly those questions and how can we line up our financial recording to make sure that we're doing the right record tracking so that we can be well positioned to compete for those resources. Usually the rule of thumb is as soon as you declare a disaster, you start keeping track of the numbers because ultimately that's the basis upon which we're going to make those claims. So stand by on that, Madam Chair. We'll have more to come on that. And I will commit to get an analysis of what we know about that out to Council within the next day or so. How's that? You bet.
All right. I'm not seeing any more questions or comments from our colleagues up here, and we do have to do the official business of just adopting our agenda and approving some of these presentations. Oh, did we have more? I'm sorry.
As much as you want, Madam Chair.
I apologize.
No, that's all right. That's all right.
I'm just feeling nervous because it's like, people don't want to be around people right now. And it's like, okay.
I get it, Madam Chair. I'll go very fast here because I know there's a couple things you just want to make sure I touched on. Continuity of government. All right, we're working with the clerk's office and the attorney's office to make sure that we keep you all in business, including that online ability to have these meetings. So we don't have that situation, which is in the works. So more to come on that. The executive authority, I think we touched on that a little bit. I don't know if you want to get into that at this point.
Mm-hmm.
So The question I got, and I think it's a completely reasonable one as you think about this, is, why is this what it is? So there's really two reasons. Number one is we are committed by council resolutions working with the National Incident Management System, of which the Incident Command System is a part. And what that basically does, this federal system, is it assumes that you have a strong, an executive mayor. I don't like the word strong mayor. The political science in me doesn't like that. You have an executive mayor, or you have a city manager or a county judge or somebody who is in charge of all of the departments. That's what it assumes. And of course, we don't have that day to day, right? So when we need to integrate into that system, we need to get that done. We have to have that interface because that's one of the things, as an input that that system is looking for. So that's what causes us to do this in the first place. Secondly, it's designed to fit our threat, hazard, and risk picture. And usually what we're talking about is a clear Sunday, and all of a sudden the storms blow up, and the tornado comes through, and all of a sudden we have to make decisions interdepartmentally and otherwise quickly in order to provide immediate life safety services, right? We have to move very, very quickly under those circumstances. So that's why it's structured the way it is. It does both of those things. It creates the nimbleness that we sometimes lack, but there's always a trade-off between transparency, not so much transparency, but engagement perhaps, and nimbleness. They're not always exactly the same, and that's why you're involved in this, and that's why it's such a key decision for the mayor to deliberate about as well, because we really are talking about not so much changing the relationship in the government, but really changing the relationship among the staff, and we appreciate having that capability as well. So this model pushes that a little bit because it seems like it's kind of slow, but it would make more sense if you put it in the context of it's a sunny Sunday and all of a sudden we've got roofs off of houses and that sort of stuff. But the same function has to happen whether the incident is expanded or contracted. So that's why it's built that way. I don't know if you have more questions about that. Perhaps it's a bit easier just to answer them. There's a list within the EOP of the functions that this turns on. It's not very many. Most of them are in the ordinance. The mayor acquires the ability to close 3.2 beer halls. I think there's only one left in the city of Minneapolis, according to the paper. So that probably shouldn't be a significant problem. But the list is there. We've designed this to make it as flexible as possible so that we don't have to be in this position. But when we have to be in this position, the tools are right to fix the situation. So unless you want to go deeper into any of the particular tools or systems, I think I will leave it at that, Madam Chair. And then I guess I would just, before taking questions, I'd just like to, Councilmember Goodman's comment kind of puts me in the mind because, and I won't tell you there I was stories, but I was standing in your office when the plane hit the World Trade Center. We did not have a primary that day. I didn't have a primary opponent. Joan Campbell and I were the only people in council chambers. I don't tell a lot of council stories in this chamber either because I don't think that's my place. But I will tell you one thing. When Stephen Bosacker called me and said, "Are you interested in being the emergency management director for the city of Minneapolis 8 years ago?" I thought about that. But there's one thing about the city of Minneapolis that I know, and that is when these situations happen, we pull together. This organization pulls together, this community pulls together, and we get it done. And if I didn't believe that, I would have told Stephen I would stay practicing law. I believe that today, or I wouldn't be standing here right now. And I think we should have great confidence, not just as an organization, but as people, that we can do this. It's going to be difficult. It's going to be hard. We're going to have some really tough decisions because we have scarce resources and big needs. None of that's it's not going to hurt any less, but we pull together as a city. And that's why I'm proud to be here today. And I appreciate all the support that we've gotten from the rest of the community, from this team, and from you all. So I don't usually make corny speeches. I try not to, but I really personally I feel that way. So I thought I'd just share that with you, and in that context, I'll answer any questions. Or you could issue staff direction not to tell any more war stories.
Thank you. We do have Councilmember Jenkins in queue.
Thank you, Madam Chair. I echo that sentiment, Mr. Lane. I do think we can get through this, having been in in deep communication with our staff and our city leadership and all of you who have presented today, as well as other department heads. I am very confident that we can rely on our team to help our community work through these really significantly trying times. I'm just curious, when you were telling your war stories, did you say we did not have a primary on Tuesday, September 11th? Because I believe we did.
Yeah, Madam Chair,
Okay.
there was a primary, but
Yes.
Joan Campbell and I did not have opponents.
Right.
Oh, okay. Got it.
You didn't either. That's right. That's right.
Yeah, I was campaigning for Councilmember Lilligren, and so we definitely had primaries that day. So, yeah.
Yeah. Nobody wants to hear people's 9/11 stories, but
Councilmember Fletcher.
Thank you, Chair Cano, and thank you for coordinating this meeting, by the way. I think one of the most precious resources that we have right now is the staff expertise and staff time in responding to this emergency, and I appreciate what everybody has done to scramble to get answers to our questions. I know that constituents and journalists and lots of other people have been watching, and I think taking the time to inform the public and taking the time to both be honest with people about the things that are hard, but also to reassure people that we have plans in the places that we do have plans, was time well spent, and I think you all rose to the occasion, and I'm deeply proud of our city and deeply proud of all of you, and we're going to be called on to do extraordinary things, and I believe we can all rise to that, so thank you.
Thank you. It looks like we don't have any more comments or questions. I really appreciate you stepping up to be able to present to us today. I know that originally when I had made the request a few weeks ago, it didn't feel as urgent as it does today. So I'm glad that we were able to have that foresight and that you were willing to work with us, as well as our Director of Health, who made some recommendations along the way about what we could do to here today. Our leadership team at the Minneapolis Fire Department and the Minneapolis Police Department, we're here for you and with you. And the amount of communication that I've seen and collaboration over the last 5 to 7 days is unprecedented, at least for me as a policymaker here being 7 years on the council. And I really do agree with you 100% that we're pulling together and we're going to get through this. So thank you so much. And without further staff comments, we do have our agenda here that we need to formalize and formally approve. So now that we have quorum, we can conduct the formal business of the committee. And so we have 3 items on our agenda, and I already read those items at the beginning. I would like to ask my colleagues to please help me adopt the agenda. All those in favor, please say aye. Aye. We have a public comment, so receiving and filing any public comments from the community regarding public safety issues. If there's anybody here from the public that would like to share any words, this would be the time. Seeing that nobody from the general public is here to speak to us this morning, let's go ahead and receive and file no comments. All those in favor, please say aye. Aye. We shall adopt the consent item, which is a gift acceptance from the East Isles Residents Association for fixed cameras on Hennepin Avenue. All those in favor, please say aye. Aye. And we shall receive and file our presentation today on COVID-19 preparedness and response. All those in favor of approving, of receiving and filing this presentation, please say aye. Aye. Without further business before us, we are adjourned. Thank you, everyone.